The challenges we have engaging sustained long-term community-based response is, I think, very much related to the funding and donor-directed obstacles that are put in place. And the onus is on the funding communities and the large funders to look at what are the major hoops that are preventing local organizations from being able to receive that funding and be able to decide on how that funding gets used. Partners in Health was started in the 1980s, and I think from that time grew from being a really small group of friends who were committed to and worked with their friends and colleagues in Haiti to a large organization where now we work in 12 different places and have over 19,000 employees and have had long-term commitments to all of those places. The challenges, I think, have been many. We've been faced with challenges of funding and challenges of natural disasters. The earthquake in Haiti in 2010 really devastated the entire country and our employees that worked there, and was a huge growth for the organization because of the need to build more of a resilient health system. Also, we've battled cyclones and hurricanes. Ebola brought us into West Africa, and it's continued to fight for a strong, comprehensive health system, not just during times of emergency, but during all the times, so that health systems are able to be more resilient in times of pandemics or in times of natural disasters. Partners in Health experience around the world in being embedded and having community-based care really allowed us to take those lessons from HIV, from TB, from Ebola, and apply it to COVID. So we knew that there had to be a community-based approach and that you had to also include elements of social support.
We have a very strong relationship with government through the Ministry of Health. Anytime that we had COVID-19 patient, we worked with the local structures, the village health workers, the health center committees to ensure that they understand how the infection can be prevented and controlled from the community. So we work with them to do like contact tracing, tests any contact, and those who are very sick, we bring them to our facilities or refer to higher level if they need intensive care.
COVID-19, I think, illuminated that there's so many gaps in how we address global health. Part of that, I think, it points to bigger issues we have in humanitarian aid, in that we're so focused on emergencies. If we would invest in a more consistent, longer-term way, not in this boom or bust of tons of funding and then systems are built and then they collapse as soon as the funding and our attention goes elsewhere. Until we really do that as a global community, we're not going to see long-term change.
It is important to shift this way of operating and try to address the root cause of diseases. I think humanitarian organizations and donors should understand that if they want to make a big impact on human lives, they should be flexible and make sure that the money is used to build health systems and address the needs of the communities.